Out of the Convention Center Clinic is raising some questions about vaccinations in the city moving forward. Joining us now live is Philadelphia Health Commissioner Dr. Thomas Farley to answer some important questions. Good morning, Dr. Farley.
Good morning.
So first of all, for people who got their first dose of the vaccinations at the Philly Fighting COVID Clinic, what's next for those folks?
We will absolutely provide a second dose to them, in all likelihood, at the same location, and we have all their records in our database, and we will be contacting them about that. So it'll be just when they were scheduled to get their second dose, it'll just be a different provider doing it.
So can you tell us about the plan going forward? Will the city be looking for other providers to help administer the vaccine?
We've always been looking for more providers to administer the vaccine. We've put out a request for proposals, and we received a number of proposals last week. As with testing, we expect we'll have a number of providers working with us, and so the loss of this one provider is not going to slow us down.
So for many people, trying to register for the vaccine can get a bit confusing. So for Philadelphians who are eligible right now, walk us through the steps, please.
First, the people who are eligible now are people over the age of 75. Or people under the age of 75 who have high-risk medical conditions, and our website lays those out, but they include things like diabetes and cancer and heart disease. For the most part, we're distributing vaccines to healthcare providers. So the healthcare providers are going to be reaching out to their patients who have those health problems. But if people feel like they may not get contacted by the healthcare provider, they can go to our website, phila.gov/vaccine-interest, or phila.gov/COVID, they'll get a link to that, and they can put in their information, and we'll contact them when an opportunity to get vaccinated is available.
Now, are the vaccinations within Philadelphia only available for Philadelphia residents, or what about people who work in the city?
We are vaccinating people who work in the city, don't live in the city. We're preferring not to vaccinate everybody who works in the city and doesn't live in here, because we're allocated vaccine according to our resident population. We have, for example, teachers that work in the city. They take care of our children. We want to make sure they're vaccinated. So definitely there will be people who work here and don't live here that will vaccinate.
What about people that do not have computer access? How can they sign up or get in line here?
Well, the simplest thing I would recommend they do is to have them just talk to someone else and who does have computer access, and have them put their information in there for them. You don't have to do it yourself. Someone else can do it for you. And a number of people are doing it for their friends, or city council members are doing it for staff. If they absolutely can't do that, they can contact the health department. We can have people do it for them.
So let me ask, Philadelphia school officials expected to reveal a plan to return to at least hybrid learning today. What do you say to teachers who may be hesitant to return to buildings before getting vaccinated?
Well, we understand why teachers are concerned. On the other hand, we have had other schools that have been open throughout this for hybrid learning, the parochial schools, for example. We do think it can be done safely. The Centers for Disease Control says it can be done safely. And I think the school district is doing it in a very gradual way, starting at the youngest grades and working their way up. So I would hope our teachers would come back and get our kids educated. That's really important.
So you mentioned that the city gets appropriated a certain number of vaccines based on residents. So put this in context, if you could, the amount of vaccines you're getting versus the demand right now at the moment.
Yeah, I'm glad you asked that. So we get 20,000 doses per week. And we estimate that in this phase 1B group that I just mentioned, there are some 400,000 people. So it's going to be weeks to months as we get through that, depending on how many people choose to be vaccinated within there. So I know many people are really eager to get this vaccine, and I'm glad that they are. But unfortunately, it's just going to take us a while to work our way through that list.
Well, Dr. Thomas Farley, we appreciate your time as always. Continue to be healthy and safe, and we look forward to future updates.
Thank you.
Thank you, sir. Turning now